Welcome back, everyone. Just washing your hands and wearing a mask is important for your health and the health of others during the pandemic, especially looking out for your own mental health, and checking in on loved ones is equally important. We know physical and mental health are connected, which is why the Office of School and Adolescent Health wants to ensure that addressing what folks can do to stay on the path to wellness. I spoke with state behavioral health consultant Shana Clausen to find out more. Joining us this morning, we have Shana Clausen, a behavioral health consultant with the Department of Health. Good morning.
Good morning. Thank you so much for having me.
Absolutely. Thank you so much for joining us. We're having a very important conversation right now in light of COVID-19 and the holidays right around the corner. Mental health has become a big topic lately. So let's start there. Tell me about the behavioral health care in New Mexico and what you guys do to help us out.
Absolutely. So I work for the New Mexico Department of Health. However, at the urging of the governor, state agencies have launched a collaborative and a multifaceted campaign to remind New Mexicans that mental health is a big part, and it is just health care. And also that access to that care is just a click or text away. So as a unified partnership with multiple state agencies, we've launched the Path to Wellness campaign, which is a unified campaign across state agencies to acknowledge that there are many paths to wellness and to make sure that those paths are accessible.
And as you mentioned, the path to wellness also includes the path to mental health as well. Are you guys experiencing more calls from people needing either guidance or maybe just some maybe tips on how to help somebody who's dealing with mental health situations?
Yes, ma'am. The need for mental health support and just acknowledging that times are hard. And with the pandemic and everything that we have going on right now, it's affecting us physically, but it's also affecting us mentally and emotionally, ourselves, our family, and our loved ones. So as we hear from folks who reach out asking for support, we want to make sure that we have a unified response to be able to support New Mexicans in understanding that it's okay to not be okay and that there is support out there.
What are you hearing when it comes to those that are contacting you and the feelings that are overcoming them at this time?
So there are a lot of different feelings that we've all felt: isolation, depression, anxiety, the uncertainty in the pandemic. Many of us have felt this at one time or another. And again, remembering that you are not alone in those feelings and in the isolation. In most crises, just like this pandemic, there's a major event and then there's a recovery. The pandemic is different. This crisis is still going on. And so the need to reduce those feelings and increase resiliency is incredibly important, and we want to provide folks those tools to be able to do that.
You know, some of our viewers may be thinking, I've never been diagnosed with a mental health disorder or I've ever been depressed, but they're having these feelings right now. Is it okay for them to recognize that they're not okay?
Absolutely. It is totally okay. We want folks to know that they're not alone in these feelings. And just because you're feeling depressed or isolated or maybe anxious doesn't mean that you necessarily have a diagnosable mental health disorder. And if you do, that's okay too. That being said, these feelings are common and there is support. We urge folks through the Path to Wellness campaign to reach out for help, that we are listening, we are here to support you. And we urge folks to do that through the New Mexico Crisis and Access Line. It's a 24/7, 365 access to licensed mental health professionals and peers with lived experience. That number is 1-855-NM-CRISIS or 662-7474, or you can go to the nmcrisisline.com. And you don't have to be in an absolute crisis state, nor do you have to be the person in crisis to call. If you want to reach out to find a mental health professional to talk to, or just to talk to someone, you can absolutely do that, and they're here to help you.
What are some tips that you could give us, maybe as we've noticed a family member has been a little distant, a little isolated? What can we do to help out?
Acknowledging it. Ignoring it is not going to make the problem go away. So acknowledging that, hey, you know what? I noticed you've been a little bit different lately, and I want to make sure you're doing okay. And I'm letting a loved one know that we are here to support them and that they don't need to feel ashamed or alone in the feelings that they're feeling. and then providing them with these resources that are easily accessible to everyone.
Shana, I want to thank you so much for joining us and shedding light on the Path to Wellness campaign and letting us know it's okay to not be okay. The Path to Wellness campaign is a collaboration of 10 groups and include the Department of Health, Behavioral Health, CYFD. For a full list of all the groups involved, head to our website. That's always on krqe.com.